This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So I'm good to start?
You are good to go.
Okie doke. So my name's Preston Hatch. I'm one of the fourth year residents here at Casa Colina. So I am the chief resident coming in this week, so I'll be giving a presentation. So our hospital is actually, our institution is located at a standalone rehab hospital. So it's 68 beds. Semi-recently, they added a med-surg floor. So we have, I think it's 25 beds. And then we also have a 7-bed ICU that's on site as well. But the majority of our campus and what we do the most of, obviously, is in the rehab floor. This is a picture. You can see Mount Baldy in the background. It's beautiful, beautiful place to live. So our program is, it's a 3-year advanced program. The name of our hospital is Casa Colina. Sometimes our name just pops up as OPTI West. Sometimes confusing. I remember I thought it was confusing when I was applying and interviewing, but it's the same thing. So, but the name of our hospital is Casa Colina. OPTI West is like a consortium of multiple residencies that are together. It's 3 years, like I said. We have 3 residents per year, so there's a total of 9 of us. Like any other PM&R program, we get a lot of applicants. It's competitive. One interesting note is that there's no other residents in the hospital. It's just us. Since it's a standalone rehab hospital, we don't have to compete to see pathology or anything. We are the only residents that are on site. So we spend the majority of our time at the hospital where we do our inpatient and our outpatient. We have some other rotations listed here, like we go to Children's Hospital in LA for our PEDS rotation, which is 2 months. We have a couple of pain groups that we work with for our pain rotations. There's a doctor in Pasadena who we rotate with for neuromuscular. There's the neurology group, which is just down the street. We do for our EMG, like a dedicated EMG rotation. We have 2 months of that. And then on campus, although it's not technically part of the hospital, is an orthopedic group that we do our orthopedic training with as well. So the vast majority of our time is spent on campus at Casa Colina. There's a few months, 2 months. Well, you'll see the schedule later, but 2 months is spent in PEDS. 2 months is spent in pain, and then a couple others that you'll be out for. The rest of it will be on site at the hospital. So here's our core faculty. Our program director is Justin Phillips up there. David Patterson is our assistant program director, has been at Casa Colina for 20 some odd years, has been around for a while. Dr. Wong has been around for I think 11 years as well. And then we have some newer faculty. Dr. Sagnell has been here for I think 6 years now. And on the bottom, Dr. Block was recently hired on. He's a graduate from 2022. So he's been here for 1 year as he came on as an attending. And this next year, we're going to start rotating with him. Dr. Frey has been around since the beginning of the program. He helps us out with our EMGs. We do a lot of spine cases with him. He comes to our clinic usually once a week. Those are our core faculty. Obviously, we have a lot of faculty given all the rotations. So we don't have to go through each person, but obviously at CHLA, we have an attending, Dr. Craig. On the interventional pain, we have 3 doctors that we'll be working with. like I said, there's an orthopedic group that we work with 2 months throughout the 3 years. And then Dr. Yagayan, who's our neuromuscular specialist that we do a rotation. So just down the street, like I said, there's a neurology group. They have, so on campus, we do quite a bit of EMGs as well, but just to bulk up our numbers, we have the neurology group that we do 2 months of dedicated EMG time. They're like 3 minutes down the street. And then we have J&K Orthopedics, which is across the street. And they have our, it's Lance, who's the guy that helps us with all of our P&O. So he loves to teach, he gives us presentations, and he's great to work with. I will make a note here. We have a unique thing in our hospital, which is the Transitional Living Center. So like I said, on the hospital campus, there's a rehab hospital, there's a small med surg and ICU. And then on campus, we have the Transitional Living Center, which is a subacute care facility. So if we have especially brain injury or spinal cord injury patients who are done with acute inpatient rehab, they don't, a lot of times can't qualify to keep staying, but they still aren't ready to go home yet. We have this option available to them. They live in the Transitional Living Center. They can get up to 5 hours of therapy per day. They still get nursing help. So it's, it's an in-between acute rehab and home for, like I said, mostly TBI and spinal cord patients. So that's pretty unique, cool thing that we can offer our patients. So here's a sample rotation of what our curriculum looks like. So as a PGY2, you do 10 months of inpatient. You do 2-month blocks with with an attending. So that speaks for itself. But 2 months of your year as a PGY2 will be spent in the outpatient. That's just across the parking lot. It's on site. So that's your PGY2. As a PGY3, you only do 2 months of inpatient, and then you start mixing in ortho, pain, your outpatient clinic. We have a few months. This schedule is a couple years old. It's mostly the same. We do TLC, which we spend on the TLC treating those patients, seeing them in clinic, but we also, it's more of like a float service. So you'll help out with inpatient or outpatient if we need coverage, that sort of thing. We also, one unique thing that it's not listed on this slideshow, is that one of our attendings goes to a SNF down the street and does consults once a week. So when you're on our TLC rotation, you also get exposed to a SNF level of care, which a lot of, or I guess some of PM&R is moving in that way. And it's good to see what private practice might look like if you were working in a SNF. So when you're on that rotation, you get to expose to that as well. Like I said, we have a dedicated EMG rotation, and then PEDS you get to do in your 3rd year. As a 4th year, it's similar to 3rd year, essentially, but then you get a research or elective to be thrown in there. Again, only 2 months inpatient as a PGY4. So that's a typical schedule for us. So inpatient, we see, we're a standalone hospital, rehab hospital. We see a lot of pathology. We're one of the only rehab hospitals in our direct area, and people come from all over Southern California to come to us. We see diverse pathology, everything really you need to see to be good at inpatient rehab. In outpatient, spasticity, concussion, injections using the ultrasound, EMGs. We used to have a dedicated OMM clinic. We still are able to do OMM with our DO attendings. We are not doing a dedicated clinic anymore just because we don't have as many DO residents to fill it. So I'm a DO. So hopefully we'll get some more DOs matching in later and we can get that going again. We do quite a bit of workers' comp. So this is a unique thing that if you want to practice that later on, there's a lot of difficulties when doing it, especially in California. So it's good to know how to work the system. how to work within the system to get things approved for your patients and to make it happen. So we do enough of that that you could take a job during workers' comp and feel very comfortable with that. Gate rounds is listed here, but we have lots of didactics, include not just like in a classroom setting, but we have gate rounds, we have rehab rounds where we talk about rehab patients. There's our didactics is pretty broad. Some additional information, didactics. So we have protected time every Friday. It's from 10 to 1. So it's 3 hours per week that we have protected time for didactics. We get lectures from residents. We get lectures from our attendings. We get lectures from outside lecturers that are professionals in their field. We do EMG, ultrasound workshops, anything that we need to build up our skills. Board review, journal club, and we have been able to go to Western U, which is a medical school down the street, and they have let us work in their cadaver lab. So we've done that a few times. It was down for COVID, but I think we're doing that again. So I got to do that this last year. The call schedule is it's you're on call for 7 weeks as a PGY2, 6 weeks as a 3, and then 5 weeks as a 4. So you're on call for a week at a time. During like Monday through Friday, you just keep doing whatever rotation you're on. You just keep doing that. But then you take call from home if something happens at night. But we do have a nocturnist. And so when you get called, it's usually for rehab related things that are non-urgent. So I was on call last week and I got woken up like 2 times all week. So not bad. And usually it's pretty simple. You can handle it over the phone. If a patient is like actually deteriorating, they call the nocturnist and you don't get called. And then obviously you're on call with an attending, so you always have help. So call is not too bad. Vacation is 15 days of PTO, 6 federal holidays, and 3 days of paid sick leave. So just some additional information here. We have a research institute, which I don't know of any other standalone rehab hospital that has a research institute attached to it. They have several studies going in connection with big institutions like UCLA, USC, and doing some really cool stuff. Mostly brain injury related. We have a couple projects for strokes. Some fascinating research happening that we can be a part of. So every year we get to do sports physicals. One of our attendings is locked in with one of the high schools in the area. So we get to help with sports physicals for them, which is super fun. And once a week, our orthopedic surgeons run a free sports clinic. So it's after hours. Basically, it's super chill. Anyone in the community can come in if they have a sports related injury. We see them. It's quick. It's like, the resident can see the patient, get a short history, like 3 to 5 minutes. You see them, you see what you think, you present in like 30 seconds to the attending, who then will teach you, coach you. Basically, it's a way for us to give back to the community, but also we can build up our sports med skills. So that's pretty fun too. An optional thing. So what makes us special? So we have 1-to-1 ratio with attendings. And because we are small, we're a community program. All the residents know each other. We know each other well. There's only 9 of us total here. So in general, we're all good friends. We actually hang out outside of work. One of the good parts about working in a rehab hospital like this, so it's an academic facility because we're here, but in general, it's a private practice hospital. So you actually get to see how private practice actually can and should run, and that prepares you for the real world of what practice might look like for you. And then obviously the perks of being in Southern California, where we are, is amazing. There's Mount Baldy, so it's honestly 15 minutes. You could be hiking, like you can see here, 45 minutes to snowboarding. I don't snowboard or ski, but people do. Getting to LA is not hard. Getting to the beach is an hour or less. And in general, the weather is amazing. So living in Southern California is a perk. It's a beautiful place to live. So where have our alumni gone? So this is a busy slide, but all of our residents have matched into whatever fellowships they were applying for. All of our residents who didn't want to get a fellowship have gotten jobs that they wanted to get. So neuromuscular, pain. We have several of our alumni who have gone into pain. We've had a few of our residents who just went straight into practice. Last year or 2 years ago, we had a spinal cord injury, a patient who went to do SCI. Last year, we had someone go to do brain injury. But I'd say the majority of our residents who do fellowship are going into pain, either interventional like sport and spine or ACG maybe.
And you have 5 minutes.
Okie doke. Perfect timing. So here's the contact information for myself and for our program coordinator and our PD. So I have one of the other residents. I got to be monitoring the chat, and so hopefully he was answering questions if they came up. But let's see what questions we have now. Okay. Are there housing, driving, meal stipends available? Oh, when you're located outside Pomona. So when you're on site, obviously not obviously, meals are all covered. We can eat if we're here in the morning, we can get breakfast, we can get lunch. We don't have to. We get all of it for free, essentially on camp at the cafeteria. But no, we don't have any housing or driving stipends when we're outside of our rotation. That would be great. Love to push for that later. I don't see any other questions, Tiffany. Oh, here we go. Do you work with adaptive sports? So before COVID, we had a much more robust connection with the adaptive sports. So there's a program called Land Meet Sea. Essentially, we take people with brain injuries, spinal cord injuries, strokes, and whatnot, and we take them out to the ocean. We put them on jet skis and boats and stuff, which is super cool. We haven't done it because they've been out for COVID, but we're supposed to be getting that back this year, so I'm excited for that. So the answer to that is yes, but lately on a hiatus. All right, how does the program work with PGY4s for research projects during the 2 research months? So that is the picture I had of our research or of that rotation. It's kind of an old, it's a couple years old. So most of the residents aren't doing a dedicated research month. Most of them just use the time to do electives. So most of our residents go and do electives with neurosurgery, who is on campus, or an extra ortho, or I think other electives that people have done. But I'm told you can do research, but I've not seen a resident do that the last 2 years, so I don't actually know what that was, to have a dedicated research month. But obviously we have to participate in research throughout our time. So most of our residents are doing either case reports, quality improvement projects. And like I said, we have a dedicated research institute, and they're doing like big projects. So if you want to be on that, then you can do that as well. All right, I think any other questions?
Are there any final questions for Casa Colina?
All right.
Expand on didactics.
Expand. So as the chief resident, I am tasked with putting together our didactic schedule. So for example, this month, since we have brand new PGY2s, our didactics are focusing on like the nuts and bolts of how to run an inpatient unit, since most of their PGY2 year is on inpatient. So we're focusing on how do you manage a TBI patient? How do you manage a spinal cord patient? What do you do with a stroke patient? How do you manage complex medical patients? So we're focusing on that. In the beginning, we get lectures on, like, for example, one of the residents will be giving a lecture on CRPS in a couple of weeks. We had a lecture last week where we brought in one of our pain docs from their clinic, and we did 3 hours of ultrasound. So they just went through joint by joint of what, the most high yield ultrasound. And we spent 3 hours working shoulder, knee, wrist, elbow. We've done before where we pull the EMG machine out and we practice. We get lectures from our PTs. So we bring them in and they'll give us lectures on how we outcome measures for strokes, or like how do we measure certain things, or how do we, how do they do rehab for particular patients. We bring in OTs, hand therapists. We've had orthopedic surgeons give us lectures on how to read MRIs of the shoulder. We have a radiologist on site who's done lectures on how to read an MRI of the brain. So just basically whatever the residents need. Can you speak?
Oh,
are we done?
Sorry, that's time. We are gonna thank you guys so much for presenting. We're gonna have Stanford present next, but if you have any contact info maybe that you can drop in the chat,
Yep.
and then folks can follow up with any questions they might still have.
Okie doke, sounds good. Thank you, everybody. Appreciate it.